Okay. You all hear me okay?
Here we are.
Sure can.
Okay. You all hear me okay? I'm getting some feedback.
Sure can.
Okay. You all hear me okay? Maybe mute yourselves, fellas, until it's your turn. There we go. All right, folks. I'm Dr. Andrew Wichterman. I'm going to let these folks introduce themselves. We're going to answer some student and some professional questions today as we get together and just have a conversation in front of you. So, Dr. Mayfield, if you want to go first, you're first on my screen.
Lovely. Hey, everybody. Dr. Mayfield, and from Texas. My specialties really revolve around families in trauma and crisis and self-injury and suicidality. And I've had the privilege of writing half a dozen books over the last couple of years on mental health issues, and just love hanging out with these guys and answering some fun questions. So excited to be here.
All right, whoever else.
Hey, I'll jump in. Dr. Jeff Klein. I live in the great state of Arkansas, northeast corner of Jonesboro, where Arkansas State University is located, about an hour west of Memphis. And I've been working in clinical practice a couple decades now, and do a lot of work with couples, families, kind of the jack of all trades, maybe master of none, but really like holistic approaches, attachment theory, and then also enjoy teaching and supervision and spiritual integration, counselor identity development. Those are topics I like.
And I'm Brian Fiddler. I live in Joplin, Missouri, southwest corner of the state. And I've been in private practice for about 15 years or so. And kind of Jeff, like you, I see individuals, couples, family, clients, and supervision, and of course, enjoy counselor education. I teach in the marriage and family therapy emphasis of at CCU. And also love family systems, attachment theory. I'm an emotionally focused therapist, so I do quite a bit of that in my work as well. And I'm leaning more and more into IFS and AEDP, which is a psychodynamic approach to addressing individual issues in counseling. So anyway, pleasure to be here. Good to see you, friends.
Okay, so I've got all the questions queued up, guys. If you want me I can put them on the screen and we can just jump right into it. You've had a chance to peek at most of them anyway ahead of time. So here we go. This is the first one. What should clinicians understand? It's a fun one right away. What should clinicians understand about schizophrenia and dissociative identity disorder, especially when violent incidents in the news create fear or confusion?
Man, let's rip the Band-Aid right off, man. Let's not throw a softball here.
I didn't even give you. I let you warm into it. Yeah. You want to go with a different one first?
No, it's good. Let's just go. Let's just do it. I have never worked with a person that is dealing with schizophrenia that has been violent. I think it's just sensationalized for sure in the media and in movies and that kind of stuff. I mean, there's a lot of, if the paranoia is set in and is active, it can feel like they're unsafe. But I'd be more concerned about them hurting themselves, and setting up a safety plan for their care versus others being worried about their safety. At least this is my 2 cents and my experience of working with that population and then the homeless population. I think there needs to be a better educative process of what schizophrenia and dissociative identity disorder actually is, because I think our society does a pretty poor job of representing it. So,
I saw a number recently that said something to the effect of folks with schizophrenia are far fewer by percentage of the violent incidents with mental illness than, say, even like somebody with personality disorder of other types. Like they were one of the more gentle groups unless they were just deep into paranoia. So it's really a sad thing.
Yeah, I appreciate that comment from both of you, Mark and Andrew, because that's been my experience too. Like working with schizophrenic patients and dissociative identity has been like I've really enjoyed and cared a lot about the clients that have come to me for both of those issues. Also, I work in outpatient private practice, and so I have a limited clientele who have been schizophrenic and dissociative identity. Like for private practice, clearly they have to have enough function to be able to come into, routine weekly sessions or whatever. I also think of dissociative identity as, well, actually Richard Schwartz in IFS talks about in his model, it can sound like we're talking about multiple personalities. And he just sort of puts out there something that I have felt for a while clinically, just that dissociative identity is like a more extreme expression of something that we all have, which is that we have ambivalence and different parts of our kind of, I'm thinking of like broken heart in terms of Isaiah 61, of like different parts of ourselves that have different motives and needs and, conflicts that we have to do business with. And so I don't know that I think of dissociative identity as like only something that very few part of the kind of people in the population ever have any kind of experience with. I think we all have some, level of this sort of broken ambivalence inside of us. And so I'm not equating that exactly with violence per se.
Well, it doesn't help that most of the movies made about this stuff, always involves like the person with DID being like a serial killer or something.
Yeah, right.
Those portrayals just further exacerbate, I think, stereotypes that are unhelpful when it comes to mental health. And then, of course, stuff just gets sensationalized whenever there is some kind of violent crime. And there is this larger conversation about how do we treat serious mental illness, and people need consistency of medication and therapy and support. And so I think the more we kind of work at it from a preventative side, that's way more helpful than just getting our information from, films or the media.
Yeah, I would say that some great resources are the Hope and Healing Institute here in Houston, Texas. Dr. Matt Sanford has a lot of good information on severe and persistently mentally ill. And that's what I would categorize this population as, severe and persistently mentally ill. NAMI has some great resources, NAMI, the national branch or our state branches. But it's important, especially if you're a pastor or a counselor watching this, to make sure that we're educated on what this is and what this isn't, so that we're not perpetuating stigma. But to your point, Jeff, like the movies no movie would sell if it was just like, oh, let's just talk about the person that's, calmly seeing and hearing things, and let's work through that together. And I mean, of course, they've got to sensationalize it to a place where it will provide intrigue, but it creates, I think, a lot of issues and problems for those that are silently suffering with that kind of stuff. And I think it deepens the struggle, because people aren't going to want to come and ask for help or talk about it, because they're going to be categorized in those ways.
And if you're a clinician or a student and you're working with a population that is schizophrenic or has dissociative identity, that you need to be trained, right, and knowing how to address that. So I think that's the other balance too. Like, that is severe mental illness that does need to be handled with competence.
Okay, you want me to move to the next question? Maybe we should have started with this second one. You're going to like it better. Have you ever worked with clients whose symptoms made you wonder whether something spiritual, not only psychological, might be involved? How do you discern the difference responsibly?
Man, oh man.
That might have been a better one to start with there. I'm just saying,
That's
man.
what I have.
But it's okay.
Next time I'll put them in better order.
I'm just kidding.
As I was thinking, I'm always thinking that there's, like, I don't know if the divide between psyche, the soul, and the spirit is quite so clean as maybe I would be comfortable with it being. It feels like there's always a spiritual component to a person that's in the room, and possibly to the symptoms or the issues that a person is dealing with. So it feels to me like I'm assessing and kind of sussing out what might be psychological versus spiritual, but it feels like there's often both, right? Rather than either or. What do you guys?
It feels like a gotcha question almost. And I'm not saying this is a gotcha question for whoever asked it or anything like that, but it kind of feels like it, because I think we've relegated the field to some of these gotcha questions. It's either psychological or it's spiritual. It can't be both. And it's like, the root word for psyche in the Greek and the Hebrew actually has the connotation of mind, body, and spirit. So it's not separated. And I think there's the temptation to over psychologicalize. Is that a word? I've just created a new word. Or over spiritualize on either spectrums. And I think we have to have a healthy balance in there. We've talked about this, and all of us are very familiar with John Eldredge and his stuff. But one of the things that I talk about all the time is that we all have a gravitational field of sin, brokenness, and spiritual warfare. And that's basically, the sin, meaning, how do we actively engage in things that are bringing this upon ourselves, our choices? What is the brokenness in the world that's affecting us from the outside? And then where's the spiritual warfare that kind of combats those things? And we have to be pretty discerning as therapists to go which is which. Obviously, when we're working with clients that don't have a faith foundation or formation, we have to be super discerning on how we engage that piece. But that doesn't make it any less real, in my opinion.
Take it, Andrew.
I was going to say, I got something actually. I had a student recently send me this. Is it Allie Beth Stuckey? I did a couple of YouTube reaction things on it. The book's called Lies My Therapist Told Me by Greg Gifford. Have any of you heard of that yet?
No.
I don't know a ton about what the subtitles, Why Christians Should Aim for More Than Just Treating Symptoms. I thought that's what we did. And he talks about how the mind and the brain are two completely separate things, at least in that podcast, and how the mind should, and I may be misrepresenting it, but the mind should influence the brain, basically, not the brain, the mind, which is why everything's basically a spiritual issue. And then you get into some of this, the Gnostic heresy type stuff, where it's easy to go to everything physical is bad at that point and everything good is spiritual. And the thing that just drives me crazy about that kind of mindset is they'll still go to the doctor for a broken leg. They'll still go to a builder to build their house, because the Bible doesn't give specific directions for building modern houses, but they'll still go to that. And so it makes me nuts. And so when I see this kind of question, it's it's always both. I think it's always both.
Well, but it's what you're saying too, Andrew, is it's super reductionistic. That frame of reference is super reductionistic in that, well, it's either the mind or it's either the brain, and we can't, for any stretch of the imagination, assume that they're both interconnected. Like how dare we? Almost, And I get so frustrated. I actually had a debate with somebody the other day about just kind of the reductionism of thought, that God is not bigger than and more encompassing than and more I don't know why we do that. I think we do it because we're able to control it, and it makes ourselves feel comfortable in some ways, probably.
And this guy's from John MacArthur's old school, master's college, because isn't there a master's seminary too? And so he's going to have that kind of thinking. And John MacArthur doubled and tripled down on that whole thing where there's no mental illness. Or he's no, what did he say? He's something effective, mental illness doesn't exist. I forget the exact wording, but anyway.
I remember years ago when I was doing campus ministry, there was this guy kind of talking about one of the tough things working with young adults is going to one extreme or the other, to where it's either it's like the deist theory where God kind of, created everything, but then we're basically left to ourselves. Or as he was describing, every time someone walks across campus, they're like, God laid this on my heart. so somewhere between like God's never involved in human affairs and, every moment of my life, let me derive some spiritual meaning in. I don't know. There's probably something in the middle of those extremes, right?
I know that the question, right, like it does reveal this kind of, I don't know, maybe this Western mindset of divide between body and spirit. And, you guys are talking about it, but it is an honest question too, because I think in church communities that I've been a part of, there is a kind of sort of it reinforces this idea that if something is spiritual, it needs to be handled by the church community or through prayer, that kind of thing. But if it's psychological, whatever that might mean, then it needs to be handled by the professional mental health community. And I love that we're trying to push against that and to muddy the waters, because they're a little bit muddy there, right? Like it's all kind of interconnected. But I do wonder if the person that asked the question, if they're, like, what's underneath the question or behind the question a little bit, like how, maybe if this is a student asking the question, how do we as clinicians discern if something maybe is, let's say, more extreme or overtly spiritual in nature, maybe spiritual warfare, versus something that is, I don't know. So I had a client recently who was reluctant to tell me, but he was saying that he heard a voice in his bedroom and kind of saw this presence. He's a believer. And he was sort of, I think, seeing if I had a category for spiritual warfare. And some clinicians may think that's, some kind of delusion or paranoia. And maybe it could be, maybe there's something, else going on for him than just spiritual warfare. So I wonder if that's a way we can talk about how do we discern the difference between maybe overt or extreme spiritual issues like spiritual warfare versus something that might be more intrinsically broken psychologically in a person.
Well, and when we think about, like, I talk a lot about like a soul care model to where we need multiple supports in life, right? So
Yeah.
we need the community. We need, supportive, accountable relationships in the body of Christ. And then some people additionally might need a support group for a specific challenge that we may be going through. And then some folks might also benefit for some counseling for a period of time. And I think when all of those are working together, people, regardless of what is producing their pain or distress, are likely to have the support that they need. But yes, I appreciate the question a lot. I just think there's so much complexity to it.
Yeah.
It's difficult to answer in any kind of tangible way.
Yeah. I think the question for me came up early on I was an intern and I had to just talk about the previous question, a dissociative identity patient, which was, we could talk about the ethics of that at a different time, but who was a believer, but also we were together with my supervisor trying to figure out what is a separate kind of personality and where was this client demonized. And that both of those were questions that were very relevant for their treatment. But yeah, by and large, I think it's the extreme examples maybe are easier to see as separate categories, but I think by and large, these are all nuanced.
All right, you guys ready for the next one? Just because of time, I can move us on to this one here. Here's the third. How should counselors respond when a client brings in mixed or confused spiritual beliefs? Here's another easy one, especially when those beliefs are harmful or when the setting limits your ability to redirect. So I think they're talking about like a secular setting there.
I'd be curious to understand what they mean by redirect, because I think we do that all the time as therapists. And so I don't necessarily think that like this question almost implies that somehow we're going to bring our own biases and beliefs into the conversation, and that's not okay at any stretch of the imagination. But how do we, I think we call out inconsistencies, we redirect and ask them questions around how that's benefiting them and how it's not benefiting them. We try to get them to dive into the logical connections of these things. We help bring up the inconsistencies of their logic. You know, my favorite question is, how's it working for you? You know, and then we figure that out, right? But it's not going, well, that's a dumb belief. Why are you thinking that? That's harming you. Like we don't do that as therapists, or we shouldn't. So I don't actually think this is as difficult as a question as it might seem, in the sense that we just use our counseling skills and we lean in and we use our modalities, and the goal is to help create cognitive dissonance and get them to see that maybe the way that they're operating is not the best for them. And when they come to that conclusion themselves, then real change actually takes hold, and then we can help resource them and help them scaffold some new beliefs and new systems and that kind of stuff. But it's going to have to be client directed. It can't be therapist imposed. And I think that's the assumption that a lot of non-Christian therapists believe about us as Christians, that we're the ones that are imposing our beliefs and our systems on our clients. And we're actually not. We're helping to try to find congruence and inconsistencies and things that are creating damage, and going, okay, let's take a step back here and go, is this how you want to live? Is this where you want to be? Is this working for you? And I would do that with a Christian client. So it's like there's no inconsistencies or discrimination in how I would approach it.
Yeah, one of the things that comes up a lot, I just did a presentation on like ethical spiritual integration, and I have another similar topic coming up at a supervision conference. And this comes up a lot, where people will say, well, I work in a community-based mental health setting and they won't allow you to talk about issues of faith. And I always make the point, well, if you're being client-centered, whatever is relevant to the client can be talked about. So, of course, it would be inappropriate if, like, the group leader, the clinician, is taking the lead in introducing the subject beyond just the biopsychosocial intake, where we're trying to learn about the client in context. But if the clients themselves are talking about the positive or negative influence of beliefs or even faith in their life, to me, these are topics that can be explored. But I think in any kind of context, you're trying to do it keeping in mind, you know, from the client's perspective, right? And so to me, it's like good client-centered care means we're not avoiding any topic that is relevant to the client in their context. But I think there is this tendency to think, well, if you're in a quote-unquote secular context, you can't talk about issues of faith. If the client's talking about it, it can be talked about, and then you can explore how are these beliefs either helpful or harmful. And again, as you were saying, Mark, it's just done by kind of helping the client be more self-aware about the function of those beliefs in their life. And sometimes we make assumptions that faith can be, you know, overly positive or negative, but that's, again, very personal and is always going to come back to the specific individual.
I love hearing what you guys are saying. Like the art of counseling is meeting a client where they are. And like I work in a private practice counseling context. I had a client came in one time, it was a couple, and the husband was a believer. The wife came in, and the first thing she said was, I don't want to talk about anything related to Jesus. She was very adamant, very colorful in how she was portraying that. And I was like, hello, I'm Brian, none of that. It was this. And so I was like, great. You seem very adamant. I want to be curious about where you're coming from. And of course I want to honor that. But as time progressed and we just, like you meet a client where they are, over time, we expanded the conversation into areas of spirituality and belief systems that affected their relationship that were relevant for them. And then I learned where some of her angst came from. And then we could talk a little bit about spiritual beliefs and history and harm from experiences in the church, that kind of thing.
I should say too, I re-summarized this question, so it's possible I didn't get at the full spirit of it, but it's the best interpretation I could give it. So it has to be under 200 characters to fit on the screen. Okay, here we go. I'm going to move it to the next one if you guys are ready.
Let's do it.
It would be fun. How should counselors handle situations where a co-leader or colleague reinforces or expands on a client's confused theology or spiritual practices outside of their scope of competence? This was a way longer question. I could give you more context if you wanted it, but
it would help if you have more context.
Okay.
Quite sure.
Yeah, I've got it pulled. Well, I don't know if I have that version pulled up or not, actually. We might have to go with it the way it is at the moment. Let me try to find it.
I guess I wonder if it's how do you handle a colleague or a co-leader who's acting unethically, like out of their scope of practice? Is it more?
Actually, I found it. If I can read it to you if you want to mute, because I could get feedback. It says, I recently heard from an LPC about, no, that's the other one. Sorry, I got the wrong one. My mistake. Keep going.
Yeah, just it could be maybe like scope of practice and ethics question, or maybe it's more about theology, spirituality, and counseling.
I think it was more that their supervisor had a client come in that had confused theology, and they were reinforcing that confused theology, but they didn't know anything about it. Like they didn't have any training in spiritual things. And so it was outside of their expertise, and they were wondering what to do about it, I think is the issue, if anything.
Well, I think you confront the person first. I mean, I think we have an ethical duty to make sure that we're practicing within our competence, right? And so if I've got somebody coming to me that they're wrestling with alcoholism, right? And that's their presenting issue, and I find that out in the biopsychosocial spiritual, I'm going to either consult with my colleague, Dr. Andreas Bienert, or I'm going to refer off to a different facility because I cannot effectively, engage that client. And I think we get lazy when it comes to things of spirituality because we think, oh, we can handle it. We're humans and we can engage in this. But I think in some ways it's the scope of practice thing I think we got to take seriously, unless we're willing to receive outside supervision, consultation, and do the homework ourselves, which I think we are all called to do. We all should be willing to do that, the perpetual learner piece. But I think that goes back to this controversial topic and article that I had tried to write on the slippery slope of affirming care. Like when we sit and affirm somebody for their delusional thinking, it perpetuates things that are not healthy. And so going back to the previous question that you were saying, Brian, like the art of counseling becomes how do we call out the inconsistencies and the fallacy without imposing our beliefs on that person to get them to think about it. But we've got to do that in a way that is efficacious to that is what was brought to us, if that makes sense. And so we have to go out and do homework. We have to go call a colleague. We have to get more resources around us, or we have to refer. And I think those are the only options, in my opinion.
Yeah, I'm a big fan of the acerbic competencies, which are just good guidelines. Like if we're going to wade into theology, like spend some time reviewing those, and beyond that, like a lot to the I think question that popped up from maybe one of the folks watching live. Yeah, I do think there's a lot of people that are increasingly confused. I think a lot of folks don't know what they believe because there's no shortage of information in the world, but figuring out what is credible and being discerning about what am I going to choose to put my beliefs in, that is very complicated. And I think a lot of things shape that over time, including our lived experience and how healthy or unhealthy our various relational contexts are. So I do think counselors are often having a front row seat to folks coming in who have a lot of identity confusion, who have a lot of confusion about their beliefs. And I don't think that our role is to of course, impose, but we can have meaningful conversations by trying to connect people with credible sources of information so that they can make then more informed choices about their beliefs and how they want to choose to live their life.
Yeah, Jeff, what you were saying, and I just saw that comment from, I think it's Cassie, about kind of getting maybe hurt in the church. I work in at the heart of the Bible Belt, and I have a lot of clients. I love to see, instead of saying Christian versus non-Christian in terms of population, I see churched versus non-churched is the way I think of it. And there are lots of clients that come with confusion or hurt or something about their theology that it's not working, or there's some sort of conflict that they're experiencing from maybe what they grew up with, that they're trying to get clearer about, or understand or work through some kind of even past trauma. And there is a lot of, I think, that word spiritual bypassing, that we can sort of say, well, not deal with the trauma somehow because we sort of put a spiritual band-aid on it. But I love that work because it allows us room to really seek God's heart, if that's something that the client wants and can do. And in doing that, we can get a little clearer about belief system that aligns more with the scriptures. Again, I'm making an assumption that someone has a belief in Christ. But I think that confused theology can be worked out sometimes through dealing and addressing with trauma, past hurt, harmful relationships, that kind of thing.
Yeah, my favorite question is, tell me where you heard that from, or tell me where you got that information from, because that tells you a little bit about because how many of us will sound bites and tweets and reels, we hear something that sounds really good, or we listen to, I'm not going to name names, but bigger church organizations in our country that are really popular right now that are just spewing a bunch of false theologies, and we have people that grab onto those for hopeful moments, right? That maybe my mental health will get better, or maybe these things will get better, because that sounds really enticing, and it just makes it worse, and makes it more convoluted or complicated.
Do you have an example of like bad theology you're talking about? You don't have to name the church, but I'm just curious because I've heard them too, but I'm just curious.
Well, hey, I sent $500 to my favorite televangelist, hoping that I'd win the lottery, and it didn't happen. So I'm really disappointed.
I've been at youth conferences where the worship leader is standing up and just going, "I pray against every spirit of anxiety and depression in Jesus' name, and I pray that spirit of anxiety and depression will come out of you." It almost treats it like a demonic type force, and it doesn't lay in. Now, do I believe that can be a powerful tool? Absolutely, but it doesn't provide the alternative. That because of the brokenness, we go back to John Eldridge's sin, brokenness, and spiritual warfare piece, it doesn't play into the fact that maybe because of the fall, our DNA has had some malformations, and it has caused some issues in our gut, in our brain, in our different places that create this pervasive anxiety. I mean, I'm not going to share too much, but I've been dealing with some pretty severe panic attacks and anxiety over the last week due to a health injury scare. And I know all the things. I teach these things. I've worked through these things with clients, and now I'm experiencing myself going, okay, I know it's complicated. I know that I had to rely on my Savior this last week and the truths of God's word, but it didn't take away the panic. It didn't take away the anxiety immediately. It did lift it over time. But I think it's these TikTok reels, sound bites, quick fixes that people are bringing in that are bad theology, that think that that's all it's going to take to get us better.
Yeah, and then people get disillusioned if they continue to struggle long term. It's tough.
Yeah, you see it all the time. Because one of the questions that I popped up, we never really got to, not questions, but statements, was basically like, do we see it a lot in session for confused theology? And I think for the little bit I do therapy anymore, like as far as hours in the week, I see it a fair amount.
Yeah.
So. It's pretty common.
Can I just make just a comment on the question? The fact that we can ask this kind of a question in the context of clinical work that we do, it's super cool to me that this is counseling is a place that people can come with confusion, or at least maybe there are symptoms they're experiencing that might have some of the roots in their view of God, view of themselves, view of other people. And there's a place that we can help clients work through these kinds of things. Like that's just what a beautiful thing to me that even exists anywhere in the community.
You got a fan on that statement. Okay, we got 2 questions left. Is it okay to move to the next one, or is there any more you guys want to? All right, because then we'll wrap it up in the full hour and we'll be good to go. All right, here we go. This one's actually kind of a fun one. I'm getting feedback again. There we go. How can Christian counselors remain client-centered and agendaless, yet still honor their identity in Christ and their calling in the counseling room?
Andrew, do your whole implicit explicit spiel.
Yeah, I could.
Well, get the Cliff Notes version of it.
Do it. Yeah, give the Cliff Notes
you know
version.
what
I'll
went
give the
through-
Cliff Notes version of my thing. So go for it.
Yeah, we all have a thing.
You know what went through my mind though on this? It was when I saw it. There's no such thing as agendaless. Like the ACA Code of Ethics is an agenda. It's a values system. It's like you can't completely rule that out. And so even when we're doing like explicit and implicit, where we're talking about it either out loud because they want us to, or we're not talking about it at all, but we're praying for them kind of quietly. There's still an agenda in the room, and the agenda is healing. And a lot of students kind of interpret this, or even new professionals, as hold on a second. As they're interpreting it as I have to like leave my personality, everything about me outside of the room. And I said, no, include your personality. That's part of what makes you a good therapist. And so this idea that like you can go completely agendaless. I mean, like I say, having an agenda for somebody to heal is an agenda. And so it's the wording and the way the ACA does it. I don't love it. I think they make, to some degree, every single therapist unethical with this kind of language. So there's my little spiel.
You mean you don't believe in value-free or value-neutral counseling?
That kind of stuff makes me so crazy.
Makes me so crazy because it causes more harm if we think that way. I mean,
you know what's funny before we get to the meat of this? It's like I remember when I was in grad school 25 years ago, and I'm reading all this research about, that had been collected in the second half of the 20th century that was looking at positive therapeutic outcomes. What do clients actually want and need to get better? And it all was coming back to stuff like, the genuineness of the counselor is what led to this strong alliance, that the quality of this relationship over time helped facilitate change. And then we've gotten so smart as a profession, we've decided, let's strip all the personality and genuineness away.
So smart.
Or like, don't we want clients to make informed choices? Like, the other thing that research has revealed is clients actually prefer working with a clinician with a similar worldview. So I think it's wise in our, go to your Psychology Today profile, right? I mean, the reason that we disclose our philosophy, approach, and even beliefs is so that clients can make more informed choices. So I think obviously we don't want to be in the business of imposing values, but the idea that we can't reveal or integrate ethically is pretty absurd.
Well, and I get why we have codes of ethics, but I think that we have to recognize that they're guidelines, but it's not law. And so I think one of the things that we have to pay attention to is how we enter to a room. So I tell this to my students all the time. I said, a biasless counseling is nearly impossible. But what you need to do is to be a good student of you. So your theology, your worldview, your upbringing, your traumas, your birth order, all the different things you have to be a good student of and pay attention to, and make sure you understand how they enter into the counseling room and still cause no harm. I think that's the task of a counselor. And so I encourage our students. I don't like the idea that we pick a theoretical orientation. I think that's the dumbest thing ever, in my opinion. And I know a lot of colleagues at CCU don't agree with me on that one. But the reason I say that is because I think it pigeonholes us into something that maybe we're not. And we then try to put on this persona of what a counselor is supposed to look like within the framework of that theory. And so I want my students to think through what does it look like? How do you understand change, and how do you perceive the human condition? And how does that inform how you sit with clients based off of then being a good student of who you are and all your things? And then go, okay, how do I see change? How do I see the human condition is our frame of reference, and I'll borrow from EMDR language, to get the train of thought or the train of change moving in our clients' lives. And I might use aspects, and don't sue me for this, Brian, but I might use aspects of IFS to help get that process moving. I might use aspects of psychodynamic. I might use aspects of different things, but it's all in the goal of how do I help get clients moving towards that direction of change. And so this question, I think, albeit good, I think, again, is a little bit reductionistic, and I think puts us in a corner that we have to be or act a certain way. And I think that's where we get lost in our counselor identity development, at least in my opinion.
So I'm with you completely. I don't make my students choose. I don't make them choose. Especially because if you consider that secular humanism is the underlying value system for most of these theories, or just secularism or atheism. And so I want them to be able to look at it discerningly and to filter that through and decide what they like and what they don't like and what fits and what doesn't fit. I don't see. Actually, I was thinking about having some of those faculty come and do this stream so we could have the conversation that do want them to choose and say you do have to. Just because it'd be an interesting conversation. But
yeah. We need to do the disclaimer that all these opinions are specific to us, no institution.
Yeah, regarding the theory conversation, I have some thoughts about that too. But the values question, you all have said it already, but it's the difference between bracketing our values versus imposing. Like, we don't vacate our values. We can't do that. We're not. You all have already said that. But Mark, you said that really. I love the way you said, like, being aware of what our biases or our values are, so that when necessary, we can make sure we're not imposing them on our clients. And in particular, especially whenever, man, there's something that's happening that really gets my blood going, and I have to be really cognizant, or maybe it only barely gets my blood going. That's sometimes harder to know. Like, when am I moving a client in a direction to serve my purposes or out of my own, values versus, the collaborative goals that we've established or are establishing, with the clients. And so, do you want, Andrew, this is your ball game. Do you want to talk theory? Would that be helpful? Or do you want to?
I don't see why not. We got a couple of minutes. We only got one question left. So if you want to say something about it, go ahead.
Yeah. I think, so there was a study recently done. I'll have to find the reference again, regarding what role theory seems to play in the counseling field. It's kind of the common factors stuff, but it was asking it from an MFT lens, a systemic lens. And it seemed to suggest that theory, like ascribing a particular scaffold to the therapeutic process, was important to the extent that a therapeutic alliance was missing. So the more securely attached that a client-counselor relationship was, the therapeutic alliance, the less important theory became. However, building up to that required a level of confidence and hope, both from the counselor and the client, that the counselor had the scaffold in place to be able to kind of provide the the boundaries and around the process of counseling. So it's like, it's important. It seemed to suggest none of the common factors research is it doesn't feel like it's all squishy, because it's hard. The variables are so many, but it seems like it's important for a counselor to have a methodology and an approach, and maybe an orientation early on. But the more that a client had confidence that the therapist was competent, and also the therapist had confidence that they knew the direction that they were going, it was less important that they had a particular theoretical orientation, like a soul orientation that they were operating by. However, that might be different in like with trauma focused therapy, maybe, EMDR versus, more eclectic approach. I don't know. I don't know what that research would suggest. So I feel like it's nuanced. It doesn't feel like it's no theory or theory.
Yeah. Well, I'm not saying don't choose just a theory. I'm just saying, like, how do you see change? How do you see the human condition is going to really guide you towards that? And it's going to line up with your biblical or Christian worldview. And so, I use the existential reality framework to guide some of that for myself, in how I see the human condition and change. But I also think the question becomes a little bit more, and I think this is why I love this question, but like a little more nuanced in the sense that if we believe that sin entered the world in Genesis 2 and 3, and that broke the connective relationship that we have with God, our human nature is to seek that out, whether we realize that or not. And so I always tell my students, these theorists are responding to that void and that call to make sense of what it means to be in this world and to be human and void of a creator or the relationship with the creator. And so I challenge them. I say, pick a theory that you disagree with and see if you could find a thread of truth in that theory based on that conversation that they are pulling and they are engaging in that reconnective process to our creator, again, whether they realize it or not. And so most of them typically choose Freudian theory, right, is the one that they disagree with most. But I'm like, well, but the ego and the superego is an amazing conversation around this conversation of brokenness and sin and being devoid or disconnected from our creator, and how our systems, our psyche and our body are trying to make sense of that. So I think that it just, sometimes I find in my own life that I can get too lazy around this, and it takes intentionality, work, and continued learning.
I like the way you're doing that as a conversation, Mark. It's like, man, we can listen, like we really need to listen deeply to these theorists and learn from them and learn where they come from and how they make sense of things. Not necessarily that we ascribe to the way that they approach therapy, but my goodness, they're brilliant in what they've devised and come up with, even secular, right? Because like you say, that there can be this element of truth, and also they all come from their own. It's like everybody could develop a theory if you it comes from their own worldview and their own experience with people and their own ways of engaging themselves and other, the process of healing and change. And it doesn't mean that what one person does is going to look identical to another. When I was learning EFT, we were told, like, go learn the model, learn it really, really, really well till it gets into your bones, and then go sit with people and throw the model out, because then you'll be sitting with people using the scaffolding, but it will be you. It'll be yours, right? You're not going to try to sort of do the Sue Johnson thing. And I love that, because I got to grow and learn a lot, and I still am, about who I am and how I sit with people that I wouldn't have done if I didn't zero in on a particular approach and try to learn it really deeply.
Good stuff. And if I can get at kind of the heart of what I hear a lot in talking to either applicants that I'm interviewing, like, their motivation for why they're wanting to enter the field is rooted in their ideas that I want to help people from a biblical worldview. And even how a lot of Christian-based programs market themselves, that's how we market it. And then when they get into a program, they learn, oh, there's all these ethics, and then you're having to operate using these theories, and you can't impose your values. And I think for some people that creates a lot of internal distress. Is it in some way a betrayal of my relationship with God or Jesus if I'm working with clients who don't believe in God or who are expressing all these beliefs and values outside of my Christianity. So I think it can produce, based on where a person is at developmentally, a lot of internal conflict. And I think a lot of what we share is, let's view this developmentally over time. And I think the more you kind of learn about cognitive complexity, and I know, Mark, you and I presented before on Fowler stages of faith development. Like, the further up we go in our own spiritual maturity, the more we can be tolerant of diverse kinds of beliefs. And one thing that every time any student that's had me hears about this is, it's called the Ways paradigm. Cheston wrote an article in 2000, and then Stuart Sicking and colleagues in 2017 on spiritual integration using this. But it has 3 different kind of lenses. So way of being, this has to do with, again, our own value system, our own worldview, certainly influenced by our Christian beliefs, if you are a Christian. And then way of conceptualizing, as Mark said earlier, we believe that there was a fall and biopsychosocial spiritual damage was done. It's at the 3rd level, way of intervening, when we're kind of getting at, what is our use of language? And so it's there that we're respecting the client's worldview and we're using a congruence-based approach with them. So that is different than like pastoral care, where you may be more overt in your use of spiritual language. But in regards to your disposition, your attitude, your ability to see that person in front of you as having value and worth, to me, that's kind of how I approach this. And so I can meet with any human on the planet so far without feeling compromised in my own personal beliefs, because I'm going to see their humanity and and have dignity and respect for that, and treat them with empathy and kindness. Now, I may ultimately reach a point where, I'm just going to have to be tolerant, that I'm not going to be in agreement with their beliefs, but that's not going to choose basically my disposition or my efforts to try to help them heal and grow in a way that aligns congruently with their expressed beliefs and values.
I love how you said that, Jeff. That's great.
Yeah, that sniffs of Jesus, right? Like, just watching Jesus interact with people in the Gospels, or the way, certainly the way that in my own experience, God has encountered me, is like, Jeff, there's nobody that you couldn't engage from that place. There's some similar research. I don't know if you can see this chart, but this is from an article, which kind of references something similar that I was from the Common Factors research, which is like a therapist's way of being is kind of foundational, the therapeutic alliance on top of that, and then the skills and techniques and theory on top of that. And the way of being, and I think, Jeff, maybe this is what you were referring to, but you can correct me if not, is like how it describes the way a therapist conveys to the other that they're valued as a unique human being and not a category of people. So like, how do I encounter you and have this profound trust that you bear the image of God and that you are profoundly valuable, and begin there,
Good stuff. We have time for the last one?
Not really. We can save it for next time.
We'll save it for next time.
Yes, next time will be, I like that we have a next time. This is fun.
Yeah, well, we can do like once a month if we have time. I'll get back with you guys. We can set up a schedule. Any last things you all want to say before we go?
No, this is fun. I like the idea, and I appreciate everyone who posed a question.
Mm-hmm.
This is something that hopefully we can continue to do if folks enjoy it and want to tune in. But yeah, this is fun. And we're maybe a little more buttoned up and formal since it's our first time. Maybe as we continue to do this.
Speak for yourself. I'm in my hoodie and I've got an injury, but I got.
Well, I don't mean in our dress. I mean in just kind of like how we would talk if there weren't a camera here. I don't know if people would enjoy that a bit more. But anyway, no, this was fun, and we welcome your feedback in regards to parts that you like or didn't like.
And questions.
Yeah, send us some more questions, and we'll answer them next time. For those who are watching, whether recording or live, just send them on over, and we'll get them on the list. So, all right, gentlemen, thanks for coming.
Yeah, you all have a great day.
Thanks, everybody.
See ya.